Firefighters and first responders are used to being on the front line of defense in an emergency, and this holds true in the midst of the COVID-19 pandemic. In addition to running into burning buildings, these first responders are going into homes, caring for and transporting people to the hospital, all while everyone else is told to practice social distancing. Many departments are asking for donations of personal protective equipment for their staff as those supplies have become scarce. Carolee McGrath spoke with West Springfield Fire Department's Deputy Chief Steve Mancino to learn more about the department's needs.
Our paramedics and EMTs get in the back of an 8x10 area. Door is shut, it's an enclosed area, as we transport these highly contagious persons, patients being brought to the hospital. I guess in some sort I feel like we're the forgotten area EMS, because you see all the donations, you see all the advertisements going towards hospitals, and we have a hardship right now for the ambulance services in Western Mass, for our PPE supplies, to keep our members protected in the back of that ambulance. And I'm not sure if the public really has that or knows that, what's actually going on out there.
I know you talked or you put something out on Facebook asking for certain supplies. Tell me a little bit about the response and what you still need.
The manager for the fire department's Facebook page put out there, we humbly ask. It's not that the members are complaining, our department's complaining for that matter, but we're in a hardship because our PPE supplies are no longer in the supply warehouses where we used to purchase them from. They're all bought up across the country. It's a pandemic and it's a crisis going on out there. Right now, it's pretty much, I've been trying warehouses all across the country to seek and receive supplies. I have received donations from people as far away from San Francisco, Seattle, Washington, and across the country who understand the hardship that the fire department and the EMS providers are having right now. And I really appreciate the outpouring of support, the letters, and whatnot that I've been receiving for our fire department.
And when you receive a call, for example, a 911 call, somebody's having chest pains, how do you go and answer that call? Obviously, you're going to take it. And of course, every single person who works for you, that's in your blood. You're there to help people. But how do you proceed differently in the midst of all this?
Well, we're still receiving those calls, whether it's for a trauma, a cardiac arrest, a respiratory issue, or any a long list of different ailments people can have. We're still receiving and responding to those calls as well. And that's on top of these suspected COVID patients and the COVID patients. We also have flu season going on, which is in the mix as well.
And so do you respond differently when you go to a house? Especially if you're going into a house and there are several family members there, you're obviously adding numbers with your crew.
Well, there's been a number of changes in how we respond, and that's from the dispatch, starting there first and foremost. They now ask a different variety of questions pertaining to if they've been around somebody who's been sick, who's been tested positive for COVID, who's had a different number of symptoms that they ask, and fever as well, to give our responders the information going in to what they may be, obviously responding to. And then, of course, once they get there, it may be unknown. Maybe the person calling doesn't know or can't answer these questions appropriately. So they have to ask them themselves when they when they actually arrive on scene. They have to actually ascertain this information from the patient.
And what are you hearing from other fire departments in the area?
We're not alone. We're not alone. Through Western Mass, they're in the same situation we are. I've talked to a number of them, and they're having difficulties maintaining their PPE to protect their providers going out in the ambulance.
So what are you doing in the meantime? If somebody doesn't have what they need, how are you making up for that?
We haven't had a shortage where our responders have been without PPE in West Springfield. However, I can say it has to be monitored. It has to be inventoried on a daily basis, making sure we have the equipment to maintain. Our engines also respond. So the engines as well as the ambulance need to have PPE on them at all times to protect the providers responding. There's a lot of stress as far as these people. They shouldn't have to worry about if we have the proper equipment to manage them on the calls, to keep them safe, to keep their families safe, and also to keep their coworkers safe.
You talked a little bit about the stress. Talk a little bit more about that and the morale of your department.
Be honest with you, these men and women, they don't hesitate. They get the call. They're right there. This is, like you said, it's in their blood. This is how they feel about their community, about taking care of people. And they don't complain. There's no issues. They, like I said, I'm very proud of what they're doing.
And how would you respond as far as, if people on your own department become sick? I know that that's becoming an issue that departments across the country are looking at, and right here in Massachusetts as well. How will you fill in those positions if you have several people out?
Well, right now there's a lot of departments in Western Massachusetts who's had people that are going out sick. And it could be COVID. A lot of people are getting tested right now for my department as well as other departments. So this is an issue. I guess you see where the issue brings you as far as manpower. We haven't had any difficulties filling our shifts. So at this point, it hasn't been an issue. But you try planning for it to see, okay, what would you do, down the road if we lost a certain number of people, or where it impacts our ability to man our shifts,
Would you call in, people who are retired off the job, or are you having any sort of conversations of helping, you helping Chicopee and South Hadley helping you, kind of a thing?
No, we use mutual aid when our calls are out, when our apparatus is all on calls. We have a mutual aid system in place in Western Mass that we use for the animals as well as for fires. And as far as calling other people in from retirement, no, that hasn't been even brought up or talked about at this point. We've been managing from within. And I seriously believe that we won't have an issue managing from within to get us through this pandemic.
Tell me a little bit about the response you've had from the community, just people not only contributing and trying to help you out, but also, saw a lot of very touching things that were on that Facebook page.
Well, people from the community have really been trying to help. Whether they bring in maybe a couple masks that they were going to use for painting, people at woodworking shops, they're bringing in some extra gloves that they may have had at the house. So from the smallest donation to the largest, we're very appreciative and grateful for the outpouring support from our community. It's and that's why to see them giving back a little bit, yeah, it matters,
I think, everybody would be in the same position. Nobody ever expected something like this. We've never lived through something like this before. How do you proceed, especially, with the demanding job that you have, as being an EMS worker and answering those 911 calls? How do you manage that job and now this extra level and layer of stress?
Well, I guess that we tried planning for it as soon as possible. This originated out in the western area with California and Washington. And as soon as it started, we tried to purchase equipment through the vendors that we use. A lot of the equipment was bought out right from the get-go, over a month ago. We're talking about something from thermometers, some of the PPE being gowns, face shields. The supply warehouses were quickly bought out. So we didn't have that as a resource for the past month. And with that being said, I've been calling different vendors from all across the country, like I said. We're trying every avenue we possibly can. We're currently using MEMA, and they're using a critical triage system in place, where they're trying to get the few of the supplies that they have, and they're spread out across the state from the hospitals to all the pre-hospital providers.
And what is your message to the residents of West Springfield as we kind of navigate through a very unprecedented time?
Well, I think the primary message to get out is with this COVID is that the hospitals are inundated right now. So if your COVID situation or you have a flu symptoms or whatnot, call your primary physician first and get their recommendation. Don't just call for an ambulance right, as soon as you have them. There's a lot of panic and anxiety going on, I think, in the community as well, in all communities right now across the country. And the primary statement to be made is call your primary provider unless you're having shortness of breath, difficulty breathing, serious medical issues that need to be addressed by getting to the hospital. I think that the physicians will direct them in the right direction, whether it's getting tested or just managing their symptoms through prescriptions. And they can do it through portals right now, teleportals and whatnot, if they can't get in for a doctor's visit or appointment. So.